right, so the sympathetic division is structurally and functionally more complex than the parasympathetic nervous system. It turns out that some structures are only innervated by your sympathetic nervous system. Sweat glands, erector pili muscle, hair follicles, and smooth muscles of all your blood vessels are only innervated by the sympathetic division, not the parasympathetic division. And we also call the sympathetic nervous system the thoracolumbar division because the spinal nerves that carry sympathetic nerve information come from thoracic and lumbar spinal nerves, specifically T1 to L2. So the preganglionic neurons of the sympathetic nervous system are actually found in the lateral horns of the spinal cord in those regions. So if we look at this sympathetic division, we find that, remember, it's the thoracolumbar. It makes sense because you have T1 to L2. And these are showing the preganglionic sympathetic neuron cell bodies in the lateral horns of the spinal cord here. These have their axons that can leave the spinal cord through the ventral root, going into the spinal nerve, and then go out through the white rami communicantes to something called the paravertebral ganglia or the sympathetic chain ganglia. Now it's in here that these can actually form synapses with superior or inferior ganglia, or they can pass right through and go to more distal ganglia elsewhere in the body. Now for the sympathetic chain ganglia, what we see here then is that we'll have parasympathetic postganglionic neurons whose axons then extend out towards their respective structure. So preganglionic nerve fibers pass through the white rami communicantes and enter the sympathetic trunk, also called the sympathetic chain ganglia or the paravertebral ganglia. And the paravertebral ganglia vary in size, position, and number. So there's actually 23 of these ganglia on either side. There's 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, and 1 coccygeal. And what this looks like is, from this view, we see our spinal cord here. This is the ventral or anterior surface of the vertebrae, posterior over here, and here's a rib. So if you look at the spinal cord here within the vertebral canal, we see our lateral horns of the spinal cord, which contain the cell bodies of our preganglionic sympathetic neurons. Their axons are going to leave the spinal cord through the ventral root, go out through the spinal nerve, where they can go through the white rami communicantes and then meet up with your sympathetic chain ganglia. Now it's here that these axons can either synapse with a postganglionic neuron in the sympathetic trunk or chain ganglia here, or those axons can go to superior or inferior regions, or those axons can actually just go back into the gray rami communicantes and then just leave through some sort of peripheral nerve. So upon entering the sympathetic trunk ganglia, these preganglionic axons can follow those 3 pathways we just talked about. So they might synapse with the trunk ganglia, and if this happens, they can either synapse with the ganglionic neuron in the same trunk, or those axons may ascend or descend to other sympathetic trunks and then exit the spinal cord there. Now, sometimes these sympathetic preganglionic axons don't synapse with the trunk ganglia. Instead, they just pass right through and form synapses with collateral ganglia, which are found in the abdominal or pelvic cavity, and then from there they'll go out to the respective organ. So just comparing the autonomic ganglia in general, we said that terminal ganglia were associated with your parasympathetic nervous system. Now because of the fact that your preganglionic parasympathetic neurons had long axons, this put our terminal ganglia either within the wall of our organ or just close to the organ, so that our postganglionic neurons actually either in the organ or really close to it, which means that that postganglionic neuron's axon is going to be short before getting to the peripheral effector. Now for the sympathetic nervous system, there's really 2 major ganglia here, 2 types rather. We have the sympathetic trunk ganglia, which go up and down the kind of thoracic region of the spinal cord. There's some in the cervical region, lumbar region as well. But they originate from the thoracolumbar divisions of spinal nerves. And then collateral ganglia, also called prevertebral ganglia, these are located more peripherally, and these are going to be anterior to the spinal cord, but kind of closer to the target organ or effector. So just as a summary of the sympathetic division of your autonomic nervous system, we can see here that, remember, it's a thoracolumbar division because the preganglionic neurons are associated with thoracic and lumbar spinal nerves, T1 to L2, and the preganglionic neurons' axons will leave the spinal cord again through the ventral root, going to the spinal nerve, and then through the white rami communicantes, where they can either synapse on the chain ganglia itself, or those axons can leave and actually exit through other like splanchnic nerves, and these can actually go to some of the prevertebral ganglia here, which are anterior to the spinal cord but also closer to the target organ, where they can synapse on our postganglionic neurons there, which have their axons that go to the target organs. Now, for the superior cervical ganglia, these postganglionic neurons have their axons that go to structures of the head and neck. So an example here is what we see is our axons from our superior cervical ganglion continue out towards the face, where they go to structures of like your iris and your lens, or your lacrimal gland, as well as a nasal mucosa. And so what the sympathetic nervous system does, your lacrimal gland, it actually inhibits the production of tears. Into your nasal mucosa, it actually inhibits the production of mucus. Into your iris, it causes pupillary dilation. Into your lens, it's involved with distant vision. Now, other branches here of the superior cervical ganglion can go to like the erector pili muscle of the skin of your body, or even salivary glands. But your sympathetic nervous system actually inhibits salivary gland production, which makes sense because you don't need to be producing saliva if you're in the fight or flight response. And your sympathetic nervous system on erector pili muscles cause goosebumps, so it causes erector pili contraction. Now, for the middle and inferior cervical ganglia here, we see that their axons actually extend out towards structures like the heart and lung via the cardiac and pulmonary plexuses. Now, on the heart, the sympathetic nervous system increases the rate of heart muscle contraction and the force of contraction, which can increase blood pressure and blood flow throughout your body. And then on your lungs, it actually causes bronchodilation, which can increase airflow. Elsewhere in the body, we're going to see things like our celiac ganglia, where our preganglionic sympathetic neurons have their axons that actually go straight through. They don't synapse on the chain ganglia. Instead, they actually synapse with these prevertebral ganglia. And then from there, we have our postganglionic neurons that then go out and send their axons to structures like the liver, the stomach, the spleen, the adrenal medulla, if that's the celiac ganglia, or if it's the superior mesenteric ganglia, that's going to go to the kidney, as well as the small intestine and portions of your large intestine. And our inferior mesenteric ganglia is going to go to basically the distal part of the large intestine, like your sigmoid colon and rectum. Now, once we get down towards the pelvic cavity, we find that some of these lumbar sympathetic nerves actually synapse with postganglionic neurons of these splanchnic nerves here. So these sacral splanchnic nerves around like S2, they actually will basically go out to the pelvic organs and then synapse on things like your urinary bladder. And actually the sympathetic effect on your urinary bladder is to inhibit bladder contraction so you don't urinate. And on your reproductive organs, it actually isn't involved with sexual excitement, but it is involved with sexual climax. We'll talk about the role of the sympathetic nervous system with orgasm once we get to AMP2 and talk about the reproductive system. Now, for the adrenal medulla pathway, this is kind of interesting because the adrenal medulla is actually an endocrine tissue, so it releases hormones, but it's a part of your sympathetic nervous system. So we find that some preganglionic fibers pass directly to the adrenal medulla without synapsing, but then they synapse on the medullary chromaffin cells of the adrenal medulla, and then causes those cells to release norepinephrine and epinephrine, also called noradrenaline and adrenaline. Now, these hormones are sympathetic hormones. They travel in the blood and they have a sympathetic effect on many distant tissues and organs throughout your body. And what's weird here is that the sympathetic ganglia and your adrenal medulla cells arise from the same embryonic tissue. They actually both come from ectoderm, which is what gives rise to nervous tissue. And you can think about the adrenal medulla as almost being like a misplaced sympathetic ganglia. It's also important to think about because if these cells are very similarly arranged in structure, like your adrenal medulla cells are very similar to neurons, it turns out that viruses that infect neurons are also going to affect the adrenal medulla. And so a lot of times you can see how like herpes viruses can go to the adrenal medulla and lead abnormal release of hormones like adrenaline and noradrenaline.